Welcome to today's Heme Consults orientation video. This is video number 17, and today I'm talking about the Coag Pharmacy Service. Super excited to be talking about the Coag Pharmacy Service because I've always thought the pharmacists were cool, especially during residency when once in a while a pharmacist would round with us and really offer us great insights. But during my fellowship, it was awesome because the pharmacists actually rounded with us, especially on the inpatient services. And I just thought, wow, pharmacists are so cool. And so how exciting it is on our consult service that we have pharmacists who are specialists in coagulation pharmacy who work with us. So I want to talk to you about them so that you know how to best make use of them. Okay, 7 ways in which the Coag pharmacy is there to help you win. Number 1 is that they are a great resource for algorithms and dot phrases. So if there is an algorithm for starting on fractionated heparin, for instance, they have it. Starting bivalirudin when the patient has renal dysfunction, they have it. They're always thinking about systems, always thinking about ways to make patients safer. And so if there's a dot phrase for anticoagulation, ask your pharmacist to share whatever they have with you. It'll save you a ton of time. Pharmacy is also a great resource, number 2, for medication dosing. So yes, you could look it up in Micromedics, you could look it up in UpToDate, or you could call the friendly pharmacist and say, hey, what makes sense for this patient who has renal impairment? You could do all, you could look it up, but sometimes you have a busy day and you haven't had a chance to go back to the computer and say, okay, now let me look up this medication dosing. Sometimes it's easy enough just to call the pharmacist, perhaps when you're running the list with them, and you say, hey, what about the dosing for this patient? What are the things I should be thinking about? If it's a patient with hemophilia, yes, there are many calculators to figure it out, but call the pharmacist because this is what they do all the time. They have tools to do these things that make it easy. And it's great that you want to learn the calculations, but sometimes you really are about efficiency without making errors. And the pharmacists are able to support you as you're making medication dosing recommendations. The other thing they do is medication monitoring. So patient had a major bleeding event. You started them on enoxaparin at a lower dosing. Now you're like, well, how much do we go up? They will help you by telling you exactly how many hours after the last dose of enoxaparin will help you get to the peak dosing level and then what to do with it afterwards. So it doesn't mean you're not learning. You are learning, but it does allow you to offload some of these tasks that they do pretty routinely so that you don't spend like 30 minutes looking up in the chart and they get to just use 2 minutes to tell you. So make sure that you engage your pharmacist when it comes to medication monitoring. They're really good at that. Okay, the other thing that the coagulation pharmacists help with is access to medications that could break the bank. So I'm talking about these biologic medications, for example, eculizumab. I'm talking about factor replacement therapy. So the hospital doesn't necessarily keep them on hand. And so they help to manage supply. And sometimes a patient comes in with a hemophilia, then they're making calls to the supply chain group and they're saying, hey, we're going to need a couple of doses of factor replacement therapy going into the weekend. So the pharmacists really help with that. And if any prior approvals are needed, they will help with that process as well. So the moment you know that the high ticket medication is going to be used, definitely talk to the pharmacist and they'll help you get the ball rolling on getting the patient the medication in a timely manner. The other thing they help you do is they'll actually take care of patients for you. So if there's a patient who needs therapeutic anticoagulation, is stable, and you have outlined a plan of action for the patient's transition back to therapeutic anticoagulation, the plan is outlined, they will take care of it. They'll see the patient daily, make sure that the patient is following the plan, and then if necessary, they'll make adjustments. This is what they do. So you want to make sure that you leverage their services respectfully so that they help you decompress the list and they can take care of patients, for example, who are on bivalirudin because of the suspicion for HIT. Those are the things they can do. They can follow the SRA, ask the team to take the patient back on heparin if negative, those kinds of things. So you want to delegate to them as much as you can. The other thing the coagulation pharmacy will help you with is transitions of care. So a patient needs an outpatient appointment to be seen in coagulation pharmacy clinic. If they're seeing the patient as while the patient is in the hospital, they can easily help facilitate those appointments. They also will help with some of these medications that need prior approvals before the patient needs the hospital. So some of these medications, for example, like caplacizumab, they will work with the company to get you to get the patient the caplacizumab before the patient leaves the hospital. So for all things medication challenges, talk to the pharmacy. They have a resource. Either they can help you directly or they have a resource that they can point you to. Finally, think about pharmacists potentially helping you with medication adherence investigation. So sometimes you're not sure, did the patient pick up their dose of Lovenox prescription? You're not sure if they did. You're not sure if there's adherence issues based on access to medications. Pharmacists are part of this great network where they can just go in the chart and sometimes they can figure it out. They can usually do it faster than you can. And sometimes they have a relationship with the outpatient pharmacist and they'll say, well, we'll call and address that question. So any medication related questions your pharmacist can help you with. So I want to invite you this week, run the list with the pharmacist before attending rounds. You have a patient with hemophilia on the service, a patient who has HIT is on bivalirudin. Run the list with the pharmacist and just see their thoughts before attending rounds. And you'll find out that you're able to take care of so many things even before the attending comes around. So as you are making use of the pharmacist respectfully and including them in your care of the patient, you're going to actually have a lot of stress relief because they're really good at what they do. They've got a wealth of information, and I know that they would love to share it with you. All right, I'll see you in the next video.